Sexual dysfunction can be a source of anxiety and shame for the person suffering, but it can also take a toll on their relationship. The inability to perform may make a person feel as if they are broken and can no longer be a good sexual or relationship partner. Today, Dr. Stan Althof and Dr. Sheryl Kingsberg will help us understand how to navigate a partner's sexual dysfunction and support them through the process.
Welcome to Sex Care is Self-Care, a conversation on women's sexual health brought to you by the Patty Brisbane Foundation for Women's Sexual Health. I'm your host, Patty Brisbane. Today, we are discussing a topic that affects a lot of couples. When one partner is suffering from sexual dysfunction, it can negatively impact their relationship. I'm joined today by two of our medical board members, Dr. Stan Althof and Dr. Sheryl Kingsberg. Dr. Althof, let's start with you since you're brand new here and everybody wants to know who you are and what do you do on a daily basis?
Well, thank you, Patty. I'm really delighted to be here and welcome to everybody who's going to be listening to this podcast. But I'm a clinical psychologist and I serve as the executive director of the Center for Marital and Sexual Health of South Florida. And I'm professor emeritus at Case Western Reserve School of Medicine. And like Sheryl, I have been president of the International Society for Women's Sexual Health and also president of the Society for Sex Therapy and Research. And I've been in clinical practice and doing research for more than 40 years.
Oh, it's great. Dr. Kingsberg, can you please introduce yourself and tell them what you do on a daily basis?
Absolutely. And it's a pleasure to be here. And I'm so thrilled that Dr. Althof has joined us. I think his best claim to fame is he trained me. And he left me to move to Florida, of all places. How dare he leave Cleveland? So I'm a clinical psychologist as well. I am the chief of the Division of Behavioral Medicine in the Department of OBGYN at University Hospitals Cleveland Medical Center and professor at Case Western Reserve University. So I run a division within women's health that allows for treating all the psychosocial issues related to the so many conditions that women end up having to deal with.
There you go. Well, we're going to start with Dr. Althof. So what does it mean when we talk about sexual dysfunction? And let's talk about what does it mean for men? What does it mean for women?
Sure. So sexual dysfunction refers to an ongoing problem. It's not like a one-off night where something doesn't work so well for one of a couple or a person. It's required that the person have the difficulty for more than 6 months and be bothered or frustrated by having the problem, whether for a man it's erectile dysfunction or a woman low desire. So again, it's a more serious thing than a one-time event where things don't work out so well. For men, we're specifically looking at hypoactive sexual desire disorder. And that mouthful essentially means that the man has little interest in being sexual, whether it's by himself or with a partner. Then we could have erectile dysfunction, where the man has difficulty achieving and maintaining a full erection. And then we have ejaculatory disorders, which are where the man ejaculates quickly, usually in less than 1 minute, or the man has delayed ejaculation, meaning he has difficulty reaching that threshold and achieving an orgasm. Then when you look at women, we also have hypoactive sexual desire disorder or low sexual interest. In the arousal disorders, there's female sexual arousal disorder. And there are 2 or 3 forms of it, one being more genitally focused. So the woman has difficulty with lubrication and there's diminished sensation. Many women experience that, especially after the menopausal transition. And then you also have what we call the cognitive version of that, where she can't seem to engage mentally in the sexual act with her partner. So we have that. Then we have the female orgasmic disorders, where the woman really struggles to get over that threshold to achieve an orgasm. And we have the pain disorders, which really have to do with pelvic pain of different sorts. All of them have both a psychological and a biological aspects, and we try to think of this as the biopsychosocial way of looking at problems.
You guys stay busy, I'm sure. That's a lot. So, Dr. Kingsberg, how does sexual dysfunction affect a person emotionally?
Well, first of all, now you can see why he trained me so well. I mean, he just is so clear about listing all the dysfunctions, what they are, how you define it, because as he said, you know, having a bad night once in a while is not sexual dysfunction. But there are 2 things that actually I wanted to add to Dr. Althof. One is looking at some of the medical conditions that cause sexual problems would be something like Peyronie's disease in men, which is curvature of the penis, that can then affect their self-esteem and their comfort with being sexual, but also their partner. So if the curvature is great enough, it will cause the partner sexual pain, right? If they're trying to have intercourse, usually if it's a female partner in this case. And then for a woman with sexual pain disorder, right, we often think about genitourinary syndrome of menopause. As Dr. Althof was talking about, menopause often can lead to other problems, and pain with penetration is one of them. And so the impact on not just the person who has the pain disorder or say the Peyronie's disorder, but on the partner is very emotional, right? Because you don't want to hurt your partner, you don't want to feel like you're causing them pain, and you are worried about embarrassing them. So there's many psychological components to even a physical problem. So when you say what's emotional, it's your internal experience of what sexuality is, positive and negative. We happen to be just talking about the negatives today because we're talking about sexual problems, but emotional can also be positive, and you don't have to have a perfectly working body to have a positive sexual experience.
There you go. Dr. Althof, how might these feelings of stress or anxiety affect one's relationship? I mean, I can't even imagine.
So, Patty, I'm going to take you back 50 years to something that Masters and Johnson said. They were really the pioneers of sex therapy. And they said there is no such thing rather, as an uninvolved partner where sexual dysfunction exists. So that was like, over 50 years ago that we got that wisdom. And, Dr. Kingsberg and I sort of talk about it takes 2 to tango, meaning that any change in one partner has a significant impact on the other. So if you take, like, again, if we start with a male who has ED, the partner may wonder, well, is it my fault? Is he no longer interested in me? And he winds up being avoidant, going to bed earlier or later than his partner. And she may wonder, is he having an affair? And their attempts at lovemaking get less frequent. So it may go from twice a week to once every 2 or 3 weeks to once a month and slowly drop out. So there's a great effect. Similarly, if you look at the other side in a heterosexual couple, if the woman has a dysfunction, such as low desire, the man may wonder the same thing. Why isn't she more interested in being sexual with me? What's going on? Is it something I've done? Is she having an affair? And it goes on and on. But the effect of this sort of dance between the partners has a great impact on both of them, and usually leads to couples' avoidance of initiation or attempts to be sexual. Plus, they start to feel bad about the relationship, wondering what's happening with us. Why now is this going on? So it's, again, looking at the biological issues, whether it's medication, whether it's some illness such as diabetes, or anything else that can affect, the terrible things that can occur to people in life, bad medical diagnosis, infidelity, all of these things can lead to issues in the relationship.
Can I also jump in and say, another colleague of ours, Barry McCarthy, who is also a clinical psychologist, has a wonderful clinical adage that I think is very useful to sort of add to what Dr. Althof said, which is when sex is good in a relationship, it's good. It adds maybe 15 to 20% added value. But when sex is bad or non-existent, it is inordinately powerful, draining that relationship more like 50 to 70%. So bad sex or no sex does way more to subvert an otherwise good relationship than good sex can save an average one, right? Many people have been in relationships where sex was really great and hot, but they're not with them anymore, right? Because there weren't enough other things to keep them together. But what I see in my practice every day are women or couples coming in, or often women, because I see more women than men, but they'll say, look, everything in my relationship is good. We're best friends. We have shared values. We have family together. But if I don't fix my sexual dysfunction, I don't know that this relationship can survive this. That's how impactful having sexual problems can be on a relationship.
Okay, so Dr. Kingsberg, I am a firm believer that communication is the most important thing in any relationship. And I'm sure that this topic is really stressful to have to talk about. How does one go about sharing these sexual concerns with their partner?
Well, first, let me say it is so important to share those sexual concerns because people in relationships think that they're really good mind readers, but they are terrible at it. And so they always make the wrong interpretation. So, for example, back to Dr. Althof's comment of, if you have a woman who has low desire, her partner thinks she must not love me anymore. How could how could you not want sex? It's fun, it's free, it's no calories. If you're not interested in sex, you're not interested in me. And no matter how much she may think, I love this person, if she doesn't say and have that conversation, which is, my appetite just isn't as strong as yours. If I had desire, it would be for you. And I actually do have some drive, but it's just not equal to yours. And so the more that I try to get my body to do something that it enjoys, but more often than it wants to, it now starts to feel like a chore. So now can we maybe negotiate a little about compromising? If you would like sex 3 or 4 times a week and I'd like sex once every 10 days, maybe once a week would be an interesting compromise so that you don't feel like you're in the Sahara Desert and I don't feel like I'm being pressured every day. So it's having that conversation, and same for men talking to their partners, say for having, ED, I just want you to know I find you incredibly desirable, but my body just doesn't work the way it used to. I don't get an instant erection. I need stimulation now. So please do not take this as lack of attraction. This is aging.
Right. And I'm sure that, if a woman is having pain, that's a hard thing, because I've had couples come to me and say, well, he thinks that, I'm cheating on him. I love him, but I'm just having, so much pain with intercourse. And I always encourage her to open up and to talk. And that's really hard because no one wants to feel broken. So you guys have got a tough job, and
but the benefits pay off, because when you can help people have that conversation, and I often will help women with genitourinary syndrome of menopause talk to their partners. Stan and I actually created a video with actors about a woman who had GSM, and then her partner could see the look of terror in her face, and then he had erectile dysfunction, and so it became a hot potato syndrome. But talking about, first of all, when you have a problem, sometimes that is a wonderful thing, because now the couple actually has to talk instead of relying on same old activities. And now they have to be more creative and talk to each other and innovate. And because, intercourse for a heterosexual couple is not a particularly reliable way for women to reach orgasm anyway. So now if you have to be a little bit more creative, you can open a whole realm of sexual pleasure.
There you go.
Right.
Dr. Althof, how can someone support their partner as they're seeking treatment for sexual concerns?
Great question. And I think Dr. Kingsberg and I see this all the time. What generally happens is the man or woman goes to the physician on their own or psychologist on their own, and we don't take sort of the perspective of this has an impact on the partner. We'll take a history of when did the pain start for the woman, how often, the location, the intensity. But a question that's missing is, what's the impact of this on your partner? And how has it changed your lovemaking? So that you want to think about that as an idea to begin with. But first of all, just going and saying to the partner, just getting this out of the black hole, so to speak, and say, I saw my psychologist, I saw my gynecologist, I saw my urologist, and he or she asked me about this problem, and we got it out in the open, and we're going to do maybe these tests. We're going to look at this. We may be looking at a change in medicine, so that sharing the idea of the treatment plan. And the idea then is giving reassurance from what I'm so glad you did that. That's great. This has been bothering us for a long time. All of that is going to be so helpful. Like instead of, such a terrible thing, as Dr. Kingsberg said, it's really an opportunity to turn things around. It may change from a penetration-focused lovemaking to other forms of lovemaking that may be more fun and enjoyable and reliable. So there's all sorts of things that you can do. Education is important. There are great books out there for people to think about reading depending on the problem. And there's also, when you run into difficulty, sex therapy techniques, whether it's for arousal, ejaculatory difficulties, or orgasmic difficulties, or pain disorders. So there's so much that we could do that adds on to, as sex therapists or psychologists, what the physician may be doing, so that the physician may address perhaps the more biological or medical issues, but we may address the more relationship or couples issues or psychological issues of anxiety. If you're having pain, you can bet that you're going to be anxious. It's like sitting down in the dental chair and the dentist reaching for the drill. That, all of us go, whoops, wait a second here. So that the idea is managing the anxiety and sometimes managing the depression that comes along with this, with whether it's a sense of loss. Patty, you use the word broken. All of these self-esteem, body issues that you deal with. So all of these are important in managing the sexual dysfunction and the couple's dysfunction.
There you go.
In fact, I actually often will invite a partner in to a session because I find it very helpful, instead of having her translate to her partner what she learned in therapy. Sometimes it's helpful to bring he or she or they in And also because sometimes I need their involvement. If she is carrying, say, a pain symptom, I need the partner's involvement so that they don't inadvertently kind of sabotage our work, and that they are invested and as committed to seeking a solution as she and I may be. And so having the partner come in is very helpful at least once, and they're usually very willing.
Well, Dr. Kingsberg, are there resources for our listeners out there to learn more about navigating a partner's sexual dysfunction? How do we find you? Does our gynecologist send us to you? I mean, how do we go about this?
Well, that's the million-dollar question. So thankfully, with virtual telehealth now, it is much easier to find a sexual medicine expert or a sex therapist that is licensed in their state, because we, for example, both Dr. Althof and I have the ability to do telehealth across about 40 states. So one place to look would be ISWISH, where we're both members, the International Society for the Study of Women's Sexual Health. They have a Find a Provider. Also, the Sexual Medicine Society of North America, which would help you find more of the male sex therapists, right? So if you want to look for a female specialist or a male specialist, somebody who specializes in, those would be two places. There are so many books now written. One actually is on sensate focus. So Masters and Johnson, 50 years ago, really developed a sex therapy technique that is truly mindfulness now, that there was no term mindfulness 50 years ago. And as wonderful as they were in doing their research, can I also point out they actually got divorced? So it's not always perfect.
I like that.
But things like Better Sex Through Mindfulness by Lori Brotto is a wonderful book for all genders to read, because it talks about just being more mindful and present instead of so judgmental and being distracted by all your fears or worries or doubts. But the Sensate Focus for Sex Therapy is also, as I was getting to, is a modern day version of Masters and Johnson's book, and it's a sort of a step-by-step written for therapists. But I find that couples themselves can read the book and do the exercises and find it very helpful about gradually focusing on the goal, which is to reduce anxiety, improve communication, not just having an orgasm. It's not just about sexual prowess. It is about being together and reducing anxiety and communication.
Well, I think that's excellent, because I don't feel that you have to be broken to seek help. And I think sometimes we learn more about our partners by exploring, in seeing a therapist. I think it's great. Is there anything else that our listeners should know about supporting a partner through their sexual health concerns? Can you speak
I
on
think one important idea is that everybody gets a turn. That's the way life is through the aging process and so on. So that I tend to think, and Dr. Kingsberg and I are kind of lucky because we've gotten to see patients over 30 years and so on of practice. So they come back. And what's so interesting is we hear the rest of the story in the next chapter and the chapter after that. And it's very clear to me that everybody gets a turn, whether it's dodging medical bullets or all sorts of things, difficulties with children, so that, I try to instill the idea of, perhaps you're the identified patient today, but not to worry. He or she might be the identified patient down the road. So, everybody is going to get a turn here.
I also, women tend to carry healthcare. So sometimes women can encourage if they have a male partner, to encourage the male partner to see a healthcare professional. It doesn't even necessarily need to be a therapist, although that can be great. But they really do manage everybody's healthcare. I have some publications on women who've had genitourinary syndrome of menopause and also just vasomotor symptoms, hot flashes and night sweats, and what their partners have done about that and how they feel about it and what's the impact. And it is very clear that partners want to be involved. They feel like they would like to help their partners. So, for example, when it comes to menopause, many male partners or just partners in general can be educated on what menopause is, what are the treatments, how can I help my hot flashing partner get some help. So it works in both directions, but sometimes it's just the gentle guidance of, let me help get you some help.
I love that, because the support for one another is so important. I want to thank my guest for this great conversation that was needed. And if you liked what you heard today, please rate and subscribe to our podcast. For more information on the Patty Brisbane Foundation for Women's Sexual Health and our focus areas, visit thepattybrisbanefoundation.org. Remember, sex care is self-care, and sexual health matters. Thank you.